Let's talk about school lockdowns and whether or not they should occur. Now, many school districts are still wondering if they should come back from the winter break. Some of them decided to take a week of virtual school just after the holidays to make sure that anything that was contracted during travel can be isolated during home working. And now the Surgeon General is saying that the goal is for U.S. schools to stay open, but some schools will have to make different decisions based on the vaccination rate and the variant transmissal rate in those areas. All I care about is that my kids are in fact going back next week. They're doing virtual school this week, and in our area, it has been declared that they will reopen. Thank God. Because I can't take too much virtual school.
I mean, we've just done such a disservice to these children by having these lockdowns. And so, I mean,
yes,
I've seen data now. We've talked about it here on the show, just how we're basically setting an entire generation back a year.
Yes.
In learning.
Yes.
Think about that. A whole year setting them back now. And why is that? I mean, specifically, it's the interaction with other students. We don't learn well. You can learn okay, but you just need that interaction. You need that one-on-one discussion with a teacher. Some kids they're just sitting there in front of a computer screen for hours a day.
It's just a stunted experience of learning in general. And I think I mentioned this a couple of weeks ago when my son had his first in-person orchestra concert in December, and the choir came out and sang, and they were singing in masks, but the administrators said they haven't had an in-person event being able to perform what they are practicing their craft in 2 years, and they're nervous. And I'm going to cry about it again, because how much do we as adults have to take responsibility for, these decisions that have cost these children, proms, graduations, performances, the ability to learn hands-on with another person, the ability to make eye contact with another person in order to understand, do you get it? Is it fine? I watched just this week my kindergartner doing these math worksheets. And there has to be someone there to say, do you understand that? What do you need help with? Right? There's so much of it that it has cost them for our inability to come to a consensus about what's right for the world. And I'm really emotional about it, obviously.
Yeah, and the thing that gets me is you look at somewhere like Sweden, and I'm reading a little blurb here. Despite Sweden having kept schools and preschools open, they found a low incident of severe COVID among school children and children of preschool age during the SARS COVID-2 pandemic. Among the 1.95 million children who were 1 to 16 years of age, 15 children had COVID, miscellaneous C, or both conditions and were admitted to an ICU, which is equal to one child in 130,000. But in the United States, or by doing the vaccine, there's a lot of data now showing that 1 in about 2,000 or to 2,700 kids are ending up with myocarditis from the vaccines and ending up in the hospital. 80% of them ending up in the hospital from that. So the risk of that is way greater than the risk of just letting them live their lives.
And sort of moving the goalpost of who has to stay home and for how long. For instance, JJ Films in our chat when we started the show said that he has 2 positive cases in his house. I assume that's it. It's a he. It may not be. And 2 non-positive cases. And so his daughter has to stay home until the 23rd of this month or something crazy like that because she's testing negative. My sister-in-law had a very similar story where her children were home from Thanksgiving until Christmas break because there was one who continued to test negative. And I get it. We want to protect the other kids, but you are costing one kid inordinately in this experience, not to mention my niece who had to stay home, who's 8, who couldn't do Christmas concerts and all kinds of winter activities and all the fun things that she missed out on. It's not nothing, right? We have to have empathy for what it costs them too.
But I don't want to be lost. I don't want to get, lost here in this. This is the Surgeon General of the United States on NPR News saying that we may need to be closing schools. And New York City already doing this. Right? New York City already closing schools and moving towards.
Nobody's asking, where's the data? Where's the science that says that we need to do this? Where is it?
And, you have to, my heart goes out for the administrators because it's awful to make decisions in a vacuum like this and then have parents who are coming to you with just absolute outrage, right?
Parents are like,
and they have worked so hard to make decisions based on like, where do the kids eat? Can they play? Can they do this activity? It's like you were once a principal and there was just this sort of assumption that kids played dodgeball or whatever. And now you have to think about every single stinking thing that kids do and say, is this allowed? Is this allowed? Is this allowed? Right?
Well, like yesterday we talked about on the show, ridiculousness on the band, students like studying band or playing a woodwind instrument. They're not allowed to play them anymore. Trumpets or anything that blows air. So they have to pantomime and pretend that they're playing the saxophone. They have to remove
Please don't do it again.
They have to remove the mouthpieces and play it as if they're blowing, but they're not actually blowing through it. Ridiculous. I mean, come on. So now we're going to be closing schools again.
This is the thing that really upsets me is like, for instance, last year where we live in Portugal, all travel, there was basically rules, but not during the holiday. So do whatever you want and then we'll see what happens. And I feel like as adults, if we really agree that the holidays are for children, then we should make decisions based on what will benefit the children. And I don't think that we are doing that. And so, we can lift rules, we can, but is that best for the children? Or is it just like we know people are not going to follow the rules, so we'll see, right? Like we should be making decisions not based on us, but based on them.
Yeah, and if you're going to make these rules, give people information on why you're making these rules. Show us data that shows why this is. If I could get behind these rules if they made sense and they showed data backing it up, but they don't.
Yeah. I just, it's hard for me to decide like which population we are preferentially treating at this point. Are we giving preference to elderly people or to workers? And then we're just like, whatever, kids will just be resilient.
Yeah, because I see in the chat, people are talking about yes, kids are not going to get COVID. And if they do, they're going to be fine, right? It's fine. But they're not going to, and actually a lot of them, it seems like they're being more hurt by the vaccine than they are actually COVID.
Just to be clear.
Yeah.
Well, okay.
But let me finish my thought, which is, so who are we then protecting? So when you close the school down, is it the administrators? Is it the teachers? Okay. Well, okay. So then say that, because it's not about the kids. And now they're saying, well, we need to get the kids vaccinated. We got to get all these kids vaccinated. And that's exactly what the Surgeon General said in this interview. He's like, look, I got 2 kids. I understand it. I understand how difficult it is. I've got 2 kids and one of them is too young to get vaccinated. So that's why we would want to keep that particular child home. I get it. Well, wait a second. So we're talking about you can still spread the disease. You can still spread the virus when you have the vaccine. So it doesn't matter if these kids are vaccinated. They're going to still spread it anyway. You're going to get it. You're going to get this vaccine. You're going to get sick from this thing.
Perhaps. Okay. Now I'm going to share my anecdote that I was
your anecdote. It's anecdote time.
From the beginning of okay. So I have a good friend who's been sober for 2 years and also recently gave up sugar. On New Year's, he was around 3 other people who all tested positive for COVID, right? And are very sick now, sick enough to stay home from work, not sick enough to be hospitalized. So my friend did not drink or have sugar around the holidays and is not sick, but they all are sharing the same virus. They all the 4 adults spent the holiday together, the holiday weekend. So this is my point to you, which I say all the time, I know, is your immunity matters. The strength of your body matters. Are you spending time weakening yourself by not sleeping, eating processed foods, and drinking alcohol a lot and lowering your immunity? You will be more likely to suffer based on whatever is going around, be it COVID, the flu, whatever it is, chickenpox outbreak, whatever. Your own strength in your own body absolutely matters. I know that's anecdotal, but I think it makes a strong point.
Well, it's anecdotal, but it's also backed up by what we talked about with the Amish story a few weeks ago here on the show.
Right.
And the Amish population in Pennsylvania, specifically in Lancaster, Pennsylvania, near where I grew up. And the Amish report is that they did pretty darn well, right? They eat healthy.
Yeah.
They eat farmed food, right? They're not eating processed food. And they made a decision that we're going to act as a community, be close. We're going to deal with this as a community.
Yeah.
And they thrived during COVID as a result of that. And so they're eating healthy. They're not, they're not lowering their overall immunity by eating all kinds of processed food and crappy things.
Do they drink at all?
I don't know. I don't know anything about.
They
I don't know.
before they join church.
Okay. I don't know anything about that, but I'm
specifically
just
at
saying
church,
that
they
the
were saying-
things that you
yeah.
do to make yourself stronger matter.
I mean,
Okay.
I know that at church, at the Amish church, the individual was talking about that. He said we were all sharing the same wine glass during
Yeah.
the service, and so we all handed down. And he's like, we were literally
And
COVID
instead of-
ran rampant through our community.
Okay.
They were saying
I
instead
don't
of
want
social distancing, like if somebody was sick, they all went to visit them at their house. They didn't stay away from the sick people.
Yeah.
And they did great.
I don't think we should say COVID doesn't hurt children, though. Like having the infection, I think we should say we're making a trade-off, right? Like because children's hospitals are also filled with COVID patients, maybe children who have other health-related
immunocompromised issues, of course,
right?
absolutely.
So I just don't think I'm not comfortable with
and
that
other things
specific
yes.
statement. But you have to think about.
But my point,
the trade-off.
My question is: are we worried about the children specifically when it comes to COVID, or are we worried about the teachers who would get COVID as a result of a child carrying it, and the child's
Yes.
fine, and the teacher
and-
gets sick?
And in most cases, COVID for a child is like the Omicron variant for an adult. It's like a cold. It's basically, I mean, for most, and like I said, unless they have serious comorbidities, they're not ending up in the hospital.
Yes.
There's more ending up in the hospital from the other things.
Yes, my 5-year-old had Delta, and I didn't know it.